Hi, this is Eric Durek, and welcome to this edition of Med Health Fit, the TV show that integrates wellness and healthcare. And this is our second part interview with Dr. James Kwako, family medical physician here in Santa Barbara, California. Welcome to this edition of the show. And we're going to be talking this edition on two different aspects. We're going to be talking about sort of the spiritual aspects of healing and just healing in general, and how maybe the integration of medicine and other types of things can help, like nutrition, exercise, whatever. And then we're also going to spend a little bit of time on your book, which was published last year. Is that correct?
Yes.
Okay, so welcome to the show. And you and I spoke a little bit before we went on the air about the topic of health. And this is a pretty interesting question that you posed sort of in general. How does a person know when they're healthy? And of course, health was defined to me in college as the absence of disease, but that's not really what it's about. How did you come up with that question? Like, how do you know when you're healthy?
Oh, it was an interesting process. Things I've read, things I've studied, things I've looked at. But it was concerning to me as I approached medical school. The closer I got, the more concerned I was about the emphasis on disease and just the physical aspects of illness, and is huge emphasis. And of course, great knowledgeable people, geniuses of sorts, are in the field, and I'm very grateful for going through medical training. Mm-hmm. It has brought me, in a short period of time, the whole gamut from birth to childhood to adulthood to old age to death, and watching people go through all of these different series. But I've also come to appreciate that there are ways that we can be healthier. There are ways we can prevent disease by defining what health is for ourselves, instead of just, oh, I have to go to the doctor, I must be sick. I mean, the old remedy was, if you had to go to the hospital, it was to die.
Right.
And fortunately, we've come a long way from there, but there's still overemphasis. If I'm going to the doctor, there's something wrong with me, mm-hmm. instead of going to the doctor to learn how to be well. Mm-hmm. And I'm not exactly sure where the idea came from, but it made sense to me from the beginning. I read Adele Davis many years ago. I'm dating myself in terms of nutrition. Yeah. That to me, the inspiration of going into medicine was to teach people how to be healthy.
Right.
And so prevent disease. I'm finding more and more that people don't appreciate the health they have until they're losing it. They've got pain, yep. They have an illness of some kind, and they long for what it was like before they became sick. And so I want to help people appreciate the fact that being healthy means a great deal. Be right. Grateful for it. I think every cell of the body has a pair of ears. It's hearing all the thoughts we have, all the feelings we have, and it is influenced by the habits we have of how we eat, how we exercise and don't exercise, and how we handle the stresses that are going on, whether we relax enough, whether we pay attention to the natural cycle of living. Mm-hmm. And it's based into our system. If we pay attention, nature has many of these avenues or sources for being well, if we'll tune into them. And we were talking in the last segment about huge number of advances that are coming up. And I'm grateful for the people who are bringing huge amounts of information, data study, meta-studies, meta-analyses of various kinds, and that's helpful. Mm-hmm. But on the other hand, to tune in to our own source of health, we have to learn how to slow down the outer input, the huge amounts of information, the huge amounts of distractions many times. We have to learn how to calm ourselves down and ask real basic questions. To what extent am I healthy? Am I as healthy as I can be? What else can I do to be healthier? How can I appreciate the health I have so that I don't end up getting sick beforehand? Mm-hmm. Unfortunately, the motivation for most people is getting sick and then begin to ask these questions.
Right.
We can ask them beforehand. And so I often am asking people, are you eating as well as you could? I see people who are basically well, but then I come back to the fact you're doing well, but are you eating as well as you could? Are you exercising as well as we could? Mm-hmm. And so one of my main goals in seeing the patients that I see is to provide guidelines for how to do that. Mm-hmm. And so I define health as a sense of vitality. Do you have vitality when you wake up in the day and you have something to look forward to? And of course, that's more than a physical thing. But are you waking up tight? Are you waking up with pain, or are you waking up with a body that's raring to go? To me, that would be part of the physical definition of well-being. Of course, not having disease is part of it, but much more than that, having a body that's eager to jump into the day. Emotionally, it's being enthused about what's coming, and looking forward to it, having an ability to pay attention to the good things that are happening. We meet all kinds of people. I meet a lot of people. Some of us meet more. Many of us are raising a family, and looking forward to that and being grateful for the various kinds of blessings, various kinds of fortunate benefits we might have, and the small things. Unfortunately, when people get sick, they're going to a doctor to hope to get well quickly. And what I'm learning is, yes, occasionally miracles do happen. Modern medicine has a great deal to offer in terms of overcoming a great deal of disease. We save lives in ways we never did before. But on the other hand, there are many small miracles happening every day. And to learn how to appreciate those make a big difference. To make it to my office, getting through the traffic, I'm grateful. I was not in an accident. I wasn't held up. I didn't get overly stressed about it. And I'm grateful for many of the people who want to come in to see me, to share their stories with me. And I hear wonderful things many times, and I'm often sharing stories of success because we need to share these so that we motivate each other to take care of ourselves, to overcome the old habits or the habits that aren't as healthy as they could be.
Well, I would imagine that since you've been through medical school, and like I say, you've had this innate yearning to go into the spiritual side and the integrative medicine side, as well as just all of the research that you had to read from the clinical side. And back in the, I got interested in the integrative medicine side. Interestingly enough, when I first moved out here to be doing classic medical research, I mean, I was doing, clinical studies, and we had to, do the institutional review board, all of the, by the book type of things. But I got involved with the Somatic Society and the Journal of Alternative Medicine. And I remember I went to a conference in San Diego and I met a woman named Candace Pert, and she was an award-winning neurobiologist, and she wrote a book called The Molecules of Emotion. And I'm talking with her in the back of this conference room. I didn't know who she was. And, oh, you're from Santa Barbara, I love it, whatever. I didn't know she was at the NIH or whatever. And she gave her talk, and she talked about neuropeptides. And she said that a lot of these neuropeptides are in your gut, and that they're basically giving you all of these instructions like the brain, but that's not the brain, it's in the gut. And then, of course, she always had this little thing that she says, so the next time you get that gut feeling, it's probably true. So she was talking about all these types of neurological things that are happening within, which nobody would think. Every cell in your body, like you said earlier, has a set of ears, and she's like, every cell in your body is its own brain, because they're actually intercommunicating. And I'm reading about fascia now. That's like the new thing I'm reading about. And I did not know that the fascial connections in the body actually communicate and transport fluids and all these other types of things. I had no idea. I just thought it was connective tissue.
It's so fascinating. I have had a couple interesting experiences, but I often ask people, what happened before the accident? What was going on in your mind? I've come to appreciate that many accidents are not accidental. And the more I ask the question, the more I get the answer. But I was giving a talk about this at the pain clinic where I was working, and while I was speaking, a sheriff came up to the clinic door, and I thought, well, this is interesting. I wonder what happened. And so right after my talk, of course, I made a point of trying to track down what took place. It turns out one patient ran into another one and called, of course, the one who got hit called and wanted police support and documentation. And so I went to the patient who did the running into the other one, found out he was very upset. He was under a huge amount of stress. His wife had chronic pain, and she wasn't getting well fast enough. He was upset at us. And so it just confirmed to me all the more that accidents often are not accidental. I've had a few small minor accidents, fortunately, but I can remember my own mood playing a role in not paying enough attention. And I see this happening with people. I had an unfortunate bit of bad news come to me a few years ago, recognize it very clearly, about having to document things much more carefully than I had been doing, which meant more time documenting instead of paying attention to who's in front of me and the best way I can help. And within a few hours, I felt a congestion within my sinuses. And sure enough, a cold developed soon after that. Fortunately, I was smart enough to remember how to adjust to this new regulation thing and made some adjustments with how I would do it. But the cold got triggered off rather quickly. And I know this happens to people, and I try and help them gain a sense of how our body has an intelligence. The cells have an intelligence. And the goal of all healing, whether it's the knife, medication, massage, exercise, is to help enliven the intelligence of the individual cells in our body so they perform in the best way possible. They need to be shown that we're grateful for their presence. And so appreciating the health we have is one of the simple steps that can set that in motion. Attracts the energy of healing, I'm sure of it.
Well, it's interesting because that's going to sort of segue right into the next question that we spoke about before we went on air is, you know, what are the common causes of diseases? And most people think, like with communicable diseases, which, you know, you get to this whole thing about the vaccinated versus the unvaccinated, and but when you really read through there, it's like, you know, you're exposed. You know, 100 years ago, people their meat was not refrigerated, their water was polluted. Some of them are today. You know, they didn't understand some of the microbiology aspects about why they get sick. And I think today a lot of it has to do with, as you just said, the emotional, which is triggering many times over years. You said, you know, from childhood, 30 years later, it starts to manifest itself.
Louis Pasteur, the founder of bacteriology and identifying bacteria as causes, said it's really the organism more than it is the invading bug that determines whether the infection really takes off. And so my goal all along has been, how can we increase the health? And so I'm asking people, what was your degree of nutritional well-being before you became sick? Were you eating well? And of course, plant foods are the healthiest foods we have. Vegetables and fruits as opposed to animal products, and I'm slowly learning more about that.
But the interesting thing about, before we get too deep into the nutrition, is that the emotional side, people may not digest foods well anyway because they're so wrapped up with whatever these emotional things are, and they're not sleeping, which is something that's really one of the big things that's happening today. Is nobody thought about not sleeping. I mean, you watched Johnny Carson and you went to bed back in the day, and now it's like, I get up 3 times a night or whatever it is. And so the emotional, so the causes of these diseases might not be like something we had mentioned earlier, cancer. I think there's a huge emotional aspect to the diagnosis of cancer. It is a physical manifestation. And yes, it might be a poor diet. Yes, it might be exposure to a carcinogen, etc. But do you ever notice the guy who owns his own business? I don't have time to be sick. I got to get to the office. Whereas the employee who doesn't like his job, he's sick all the time.
Right. Carl Symington is a radiation therapist. He's several years ago he started a study showing that the degree of optimism you have in your medical team determines how well you respond to surgery. And then he did a study on women with breast cancer, and he found that there was a difference between those who were outgoing as opposed to those who were ingoing, those who were inhibited or more quiet as opposed to those
introverted, extroverted.
Correct.
Type? Okay.
And those who were extroverted had a much lower incidence of having a positive biopsy for breast cancer as opposed to those who were introverted. So it's very clear. I was part of a small panel in terms of talking about cancer, and we had a wonderful oncologist on the panel, but his sense was that it was a matter of luck or bad luck. And I've come to appreciate that we're much more complex than that our choices do play a big role. And it's not for the purpose of blaming people, it's for the purpose of bringing the control of our life and what happens to us back in our whole hand, so that we can recognize the choices we made in terms of feelings, thinking, in terms of whether we pay attention to the source of life within us, and how we proceed with that. That's the goal. We have that within us no matter what circumstance we're in.
So when someone comes to your office, and they talk about, I just don't know how this could have happened to me. Do you sort of gently guide them to a spot where, like you say, something about your nutritional aspect or something about your patterns that you sort of put the pieces of the puzzle together and try to give them maybe step over this way and do things a little bit differently, as opposed to, continuing to trudge down this path? Because like I say, the causes of diseases, I'm seeing at my age right now, in my mid to late 50s, the people who did certain exercise programs in high school, ran a lot, wrestling, football, a lot of wear and tear on the joints. About half my friends now have knee replacement or hip replacement. And I got a friend of mine who's 52 and he's on his third hip replacement already. Oh. And so that's another story, but I'm saying that what they did when they were younger, and I was always one of those guys, maybe I was just lazy, I didn't want to run 80 miles a week. I thought it was silly. I said, I'll run 12 or 15 miles a week, but I'll do it fast. And I'm still running at almost 60, and most of my friends completely don't run anymore.
Ken Cooper had a wonderful statement about that, and I just happened to meet him again recently at a conference I went to. He's still as enthused as ever about exploring and sharing his news about exercise, but he said there's 4 kinds of exercises. There's beginners, intermediates, advanced, and mature. And the mature exercisers are those who do enough to be physically healthy,
right,
but no more than that.
Yeah.
And my wife did a great deal of gymnastics when she was in high school, and they don't tell us that if you overextend, if you overexercise, you age those cells faster. And that's what's happened to some of your friends. And so the idea is, learn how to balance that, so that you don't overextend it, and yet develop eventually a mature amount of exercise, a mature amount of eating well, and hopefully the results come from that.
I'll ask you a quick question about your wife. As a former gymnast, does she still have like strong bone structure and all that kind of stuff?
In some ways, but it wore her hands out because she did a great deal of stuff with her hands. Okay. And that's part of what makes it difficult.
There's a company here in Santa Barbara called OsteoStrong, and I interviewed Yvonne Parsons on this show. It was a great interview. And then a month later, her boss, Dr. John Jaquish from the Bay Area, came down and spoke about OsteoStrong and osteogenic loading, and that this new era of exercise is really looking at bone health as opposed to just getting strong muscles. And OsteoStrong and CrossFit were both started by people who were former gymnasts, and they looked at the osteogenic loading of gymnastics and said, those people have the healthiest bones. Throughout their lifetime, they have the healthiest bones. And I never really thought of it because all the gymnasts I know were injured. They were always injured. The hands, it was hips, everything, because you see how much, just how amazing that they do these things now. I mean, the girl from UCLA here a few months ago who was all over YouTube because she scored a perfect 10 in this routine, and she'd like a quadruple flip or something. It was absolutely amazing, the amount of torque that she had to put on her body doing these things. But anyway, I find it interesting because what people do, and I would never recommend gymnastics to people because I know I wouldn't recommend pole vaulting to most of my friends. But a friend of mine who's a doctor in Ventura is an internationally acclaimed pole vaulter at 60. He's almost 60 years old, and he pole vaults 13 feet.
Whoa.
And for 60 years old, that's amazing. And he is healthy enough. He's a sports medicine chiropractor to keep himself in really good shape. But he is in the mature. He doesn't want to get hurt. And I don't want to get hurt. My whole goal for exercise these days, don't get hurt, live to fight another day is my motto. So I still train 6 or 7 days a week, but I don't train like I did in college.
Yes.
So I was very lucky. So the next question here is, what are the major obstacles to healing? And I'm sure today there are a lot of them. I mean, stress and all these types of things.
Right, there are many obstacles. In the book I talk about 2 major ones. One is past and the other is the present. By the past I mean the habits we have. And those habits have been reinforced so many times. How we eat, what we do with our body, hundreds, thousands of times. And those routines have control over us. We have to learn how to rise above those and impose new routines when we find out that they're not as healthy as they could be. And so we have to learn how to change our eating habits. And that's not easy because thousands of chemicals are in the foods we eat every day, and our body gets used to those.
Right.
And so And then for today, the past, of course, is one thing, what we're used to, what we're raised with, what we think have been guidelines by people we admired and followed, heroes that we imitated. And then the present. I see the present as obstacles because we don't know enough about how to eat. We don't spend enough time finding the best ways to do it, or we allow ourselves to get distracted from the habits we know we need to do.
Speaking of nutrition, I wanted to quote this study that a friend of mine from Phoenix, Arizona published in the Journal of Clinical Trials back in November. And it was essentially looking at what I'll call integrative medicine procedures like New Calm and compression sleeves and hypobaric therapy, along with a keto diet. And they essentially reversed Alzheimer's disease in 5 patients. Very interesting study. But she really put a lot of credence on the keto diet. Do you think that, I mean, Atkins and low-cal, whatever, do you think that there's some teeth in the keto diet? Because a lot of people swear by it.
They do, and I have patients who are better. I have friends who are better. There's no question that in the short run, it is helping people lose weight. It's helping people feeling better, feeling stronger. I'm concerned about the long-term consequences, however. I think the Mediterranean diet provides probably better balanced overall approach, huge amount of studies on it, and over a long range of time. Ketogenics diet is still pretty new. And there's 2 ways we can determine the real benefits of these diets. One is, what is the short-term benefits in terms of lab work, in terms of reports of people? But then the other big thing is, what's the long-range benefits? My concern more and more is the adverse effect of animal products. The China study, Loma Linda did studies on this. The incidence of heart disease is 50% less. Incidence of cancer is 50 to 60% less in those who eat vegetables and fruits, primarily, and very few animal products. That impresses me. I'm concerned about the keto diet because it emphasizes animal products. Not all, there's many modifications of this, and people usually individualize it to a certain extent. But I'm concerned about that aspect of it. I think the vegetables and fruits are easier to digest, especially as we get older, and there's certainly fewer fats, and the fats play a huge role. The liver can only handle so much. I'm going to be giving a talk soon on intestinal health and well-being in terms of the liver, but I've been reading more and more about how the liver affects every organ of the body, like you were referring to Candace Pert and some of the peptides in the intestinal area affecting the brain and how it works.
They are. It's almost like it is the brain.
Yes, there is a brain, and so some people refer to the intestines as the second brain.
I feel that nutrition is a big obstacle to people's healing because people eat when they're scared, they eat when they're depressed, they eat, I got divorced or whatever, so they eat the wrong things. And I get caught up a little bit of that myself. My grandparents on my father's side lived on a farm, fresh eggs, fresh beef, fresh vegetables. I mean, they had a compost pile that was 10 feet high, and I remember those things. And I always felt that my grandmother didn't have a lot of education, but and she never exercised. And my grandparents, none of them exercised a day in their life. I mean, they worked, but they never went out and jogged. My father was the first one that did that. But they ate good food, and they had that sense of family, and they lived a lot more calm life than people today. And I think that part of this thing about obstacles is like from nutrition standpoint is people still. They equate going to a fancy restaurant with eating well, and go to the farmer's market, you'll eat well. And we're really, you've used the word blessed a couple times in your statements. We are in this community, from the standpoint of good fruits and vegetables, I don't think anywhere in the country. Santa Monica Farmers Market, down in Texas Farmers Market, in Fort Worth or whatever.
And we're learning about organic foods, organically raised foods, and they're much more available than they used to be, and there's more that can be done along those lines. It is fascinating, huge topic, but the bottom line is, can you feel a greater sense of vitality and energy from the food you eat, and do you pay attention enough so that you can slowly train yourself to choose the foods that you know are going to be healthy for you? I feel it too. The more stress I'm under, I have a sweet tooth, and I'll look for something or think, oh, I need some. I worked very hard today. I deserve something that would be very enjoyable. But over time, we can train ourselves to enjoy the things that are good for the body. And instead of the taste buds determining what we choose to eat, it's the body as a whole. It's our health tomorrow, next week, next month, next year that can become the deciding factor.
Mm-hmm. So I'm going to do one more question about medicine, and I'm going to spend the last couple minutes talking about your book. Last night on 60 Minutes, they had a very interesting story about physicians and medical debt. And I think the average physician coming out of 6 or 7 years of their residency is well over 100,000. Some of these students were 200,000. Well, they had a guy who was, I don't know, the founder of Home Depot, who's worth billions of dollars, essentially is gifting to all medical students at New York University Medical College free tuition.
Wow.
And if you're a senior, you get your last year, but if you're an incoming freshman starting this past fall, you get 4 years of medical school and whatever resident, all the tuition is free. And it's going to be a huge burden taken off of these students. And you had mentioned in the last segment about the next generation of physicians, and I think a lot of people 5-10 years ago didn't want to go into medicine because they say to themselves, I'm not going to handle the equivalent of buying a new house just out of school before I even get to buy a house. And I think with this, I know that Harvard and these other schools are so well endowed, they could actually do the same thing. Do you think that this next generation of doctors, that's going to be a big deal?
I'm sure it is, and those students are fortunate to have a benefactor. There's many ways of looking at it. I think the other thing that's coming in that young medical students, physicians are beginning to pay attention to is that their lifestyle, their own lifestyle plays a role in terms of how healthy they will be. Mm-hmm. And there's less willingness to spend day after day without enough sleep, pushing themselves intensely. And so many of them are choosing a healthier lifestyle. Mm-hmm. I think that'll make a huge difference in terms of how they do.
I always thought those 36-hour rounds were kind of crazy, but I never had to do them. So your book is Mobilizing Your Healing Power. It's locally at Chaucer's.
Yes.
It's on Amazon. It's
Yes.
on your website.
Yes.
So people can get it, and I think what I liked about it, and I did read it. I shouldn't say this, but I actually highlighted some things with my yellow marker. And I just found it very interesting because, like I say, I like the spiritual aspect of it. So I'm going to encourage the folks who are watching these segments on Facebook and whatever to get this book because it's a very interesting book. It's about how you can sort of take charge, and I know that a lot of people want to do that. So we've done 2 segments. I appreciate you being on both of them. Dr. James Kwako, family medicine practitioner here in Santa Barbara. This is Eric Durack for MedHealthFit.com. Thank you for being on 2 segments, and we'll see you next time on MedHealthFit.
Thank you.
Thank you. Appreciate it.